Hey guys, how's it going? A real quick discussion about white cells. They're there to fight an infections. And within the white cells, you got 5 different kinds. Did you know that? And the majority of them, they are neutrophils. Okay. That's about 50 to 60%. That's there to fight an acute infection. And then the second, highest, that's lymphocytes. And they are about 30-40%. And they come a little later to fight an infection. Within that, you have a T lymphocyte and a B lymphocyte, and the T lymphocytes, they form memory, and then the B lymphocytes, they're able to mass produce antibodies so that the antibodies can just go finish an infection off along with the neutrophils. So that's the lymphocyte. And then, of course, the lymphocytes, they are the main defense to fight against viral infections, okay? And then the third highest within the white cell, that is monocyte. That's about 10%. And monocytes become really macrophages, and they just do the cleanup job. And then the fourth type of white cell, that's eosinophils, okay? And they are about 3 to 4%. And then the last one, that's basophil, that's about 1%. And these two go fight parasitic infections, like if you have worm infestation within your intestines, stuff like that. Amazing, isn't it? How, within the white cell count, you got these 5 different kinds. And normal is between 4,000 and 10,000. And when you have an acute infection, whatever your normal was, from there, the white cell count is just going to jump up. So if you had a normal of 10,000 and then you have an acute infection, then now your white cell count is going to be 15,000. So the extra 5,000 white cells that are roaming around in your blood, they are predominantly neutrophils, okay? And then whenever your white cell count drop lower than 4,000, then that's low. That's dangerous, because then you don't have the ability to fight an infection. That is the technical term, neutropenia. That means that your neutrophil counts are low. So when it is between 1,000 to 1,500, that's mild neutropenia. And when it is less than 500, that's severe neutropenia. Sadly, cancer patients go through this. With each chemotherapy cycle, their, white cell counts are really hit really hard by the chemotherapy. So their counts really drop dramatically. And then that's why right after the chemotherapy, when their white cell counts are running really low, they are at a high risk for infections. So this white cell count business within our body is amazing. They are the cops of our body. And the take home point is that the neutrophils, they are like your first responder. When you call 911, the cops quickly come. So like that, the neutrophils, they go up to go fight an infection. And then the monocytes, they also go up. And then the lymphocytes, they are like detectives. So they form memory, who the criminal is, and then they send antibodies and they do the killing work later. And then eosinophils and basophils, they take care of parasitic infections and allergies and stuff, okay? Talk to you later in my next post, guys. I hope you found this interesting. Goodbye.